Hello, hello. So I am not using any names, but I think you know who this patient is. I'm not using names because the result is so good that I might even want to post this on YouTube without any identifying markers. So let me just show you what has happened, and I'll try to catch myself if I say your child's name. So when we started, there was quite a bit of crowding of the front teeth. And here is how the upper teeth look right now. So this is pretty much perfectly aligned. This tooth maybe needs a teeny bit more rotation, which you see built into this little correction right here over 6 aligners. What I want to point out is that I've been doing this for 30 years, and I can tell you with a pretty high confidence interval that uh, over 50% of orthodontists who would see your child coming in with this overbite and this overlap of the front teeth and what appears to be sort of a narrower smile would say that your child needs a palate expander, which we did not use, as you know. We just used aligners to broaden the arc. And the key to my diagnosis was not so much the front, but it was the way the entire roof of the mouth and back teeth were positioned and the way the bite was at the start of the treatment. You don't see any kind of a cross bite back here. And so I'm really glad we didn't use the expander because it's not an easy appliance to tolerate. But orthodontists are creatures of habit, and we've always done things one way. And I've been really high on Invisalign for 20 years, but on teens for the last several. And so the first thing is the expansion of the arc is fantastic. But even more to the point of my really surprise at how great things look is that we had what's called a class 2 malocclusion. The upper teeth were biting directly over the lower teeth. You see that? And on this side, you see that here. Now, this is not terrible. Adults come in biting like this all the time, and some have issues and some don't. Some people have issues with perfect bites, but we aspire to get the teeth to fit like this, where they interlock like mechanical gears. The reason your child had this to start is because the lower jaw was farther back. And as you know, we used rubber bands, and your child did a great job wearing them. And now the bite is perfect. We just need the teeth a little bit to tighten into something like this. And I'll tell you in a minute how we go about doing that. We started the treatment in September of 2022. So this has been 15 months. And if you ask a lot of people that you may know who have kids or maybe even yourself, people wear braces for 2 years. That is a long time where you can't brush properly. It's uncomfortable. You have to watch what you eat. Now, listen, I use braces all the time still. But this was a case that maybe a couple of years ago I would have told the parents braces would be better. But I'm so glad that we went this way. In fact, I haven't even touched on the fact that the canine was up so high to start, and we brought it down just with the attachment on the tooth and the aligners. So I'll take some credit for this, but I'll give you credit, A, for trusting that we went with the Invisalign, and B, for your child's unbelievable cooperation with the aligners. Now, here's the good news I have for you. What we're going to do at this point is we're going to order anywhere from 6 to 10 more aligners. But these aligners are not going to be changed every week. They are not going to be changed every week. And they're not going to be worn full time. I'm going to make aligners that are going to be worn for about a month each. And then I'm going to give your child probably 3 to 4 of them, and we're going to check back in 3 to 4 months. And so we're sort of in interim retainers. So your child is done wearing the retainers full time at this point. And so I think that despite the great cooperation, your child will probably be happy with this news. So you may already have a visit scheduled keep that visit, and I'll see you in a few weeks. And if you have any questions, let me know.